So in this video we are going to talk about the test for cervical instability or the clearing test to examine is there any instability in the cervical spine. Now, in this video we are going to talk about mainly two tests, short purser test and transverse ligament stress test. So short purser test examines the atlantoaxial articulation where transverse ligament is responsible for stability at the atlantoaxial joint. So transverse ligament holds the odontoid process of axis relatively to atlas. Now, is there any tone in the transverse ligament? So atlas will subluxate forward on C2 and patient will have all the signs and symptoms of cervical instability. Now, how to examine the short purser test? So in that, the examiner stabilizes the spinous process of the axis and other hand on the patient's forehead and asks the patient to go for forward flexion. While the patient is doing forward flexion, the examiner applies the posterior directed force on the forehead. In that, if there is any torn in the transverse ligament, the atlas subluxate forward and patient will have all the symptoms of cervical instability. There is muscle spasm, severe headache, paresthesia of the lip and face. Now, Espinal et al. Suggested that doing the test in a different pattern, like transverse ligament stress test. How? So patient is in a supine position and examiner supports the occiput and C1 with one hand, and without doing any flexion or extension movement, examiner translate the head and atlas in anterior directed position. If there is any instability, patient will reproduce the symptoms. Ray and Ein suggested that other test for hypomobility in a mid-cervical spine from C3, C4 and C5, where a posterior-anterior cervical mobility test or posterior-anterior spinous translation movement is applied and check for any instability or abnormal resistance in the movement. Second, now the next test we'll move is the transverse ligament stress test. So it is similar to the Espinal transverse ligament stress test where the patient is in a supine position. Examiner supports the patient's occiput with one hand and stabilizes the patient's occiput on the hand. Now, between the spinous process of the second cervical vertebra and occiput, patient, you will find the neural arch of the C1. So examiner takes the C1 and the occiput in a forward translation and hold that position for 10 to 20 seconds. If there are any reproduction of symptoms like muscle spasm, severe headache, lump-like sensation in the throat, or paresthesia or of the face and lips, that means the test is positive. Kale et al. Advocated that doing the same test in a different pattern where the transverse process of the second cervical vertebra is stabilized with one hand and with the other hand the neural arch of the C1 give the shear forces to that and check for any reproduction of stability, any reproduction of the symptoms of cervical instability. Thank you.